Okay. So let's proceed with the blood donor selection. So what are our criteria for blood donor selection for autologous donations? So autologous again, autologous meaning you're going to donate blood for yourself then. Okay? So again, this is uh, they are termed as donor patient. So considered as the safest blood to be transfused. Okay? So advantage siya sa mga tao may rare blood types. So for autologous donation, no age limit, no strict weight requirements din. Although ang hemoglobin dapat is greater than 11 grams per DL and ang hematocrit is greater than 33%. We have different forms of autologous donation. This is already discussed sa lecture. So again, yung pre-operative collection natin, blood is withdrawn before an anticipated transfusion and stored until use. Pag acute normovolemic hemodilution naman, so removal of whole blood from a patient with a concurrent infusion of crystalloids or colloid before surgical blood loss. Intraoperative naman is collection from the surgical site during operations. You have post-operative naman is bloods collected from a drainage tube placed at the surgical site and then reinfused kay patient. So donor history again, this is an example of a donor history questionnaire. Okay. So ano naman ang criteria natin for allogenic donations? Number one, donor appearance. So generally well, dapat not from febrile, not breathless or has cough. Okay, so dapat generally mukha siyang healthy. So have a sound mental status. So not under the influence of drugs or alcohol. Normal color of skin, mucous membrane. Venipuncture site should be clean, walang skin lesions. Arms should be inspected for signs of injected drug use. Okay, so Asian weight for allogenic donation. So new donors, it should be 16 to 65 years old. Okay, less than 18 years old must have written consent from their parents or kaya guardian. Regular donors naman, pwedeng hanggang 70 years old or greater than 70 years old. Pag lapsed donor naman, greater than 60 years old. Pwede. Okay, this is as long as with evaluation and consent of medical officer. So as long as kaya pa nila, basically. Okay. Standard weight natin should be around 50 kilograms or 110 pounds. But again, on some institutions, hindi nila sinatanggap yung saktong 50 kasi considering the weight of the clothes pa. Okay, so hindi, ayun. So around 51, 52, ganyan. Okay, yun yung dapat na weight. Volume and quantity of blood to be drawn. So, 450 ml, okay, plus minus 10%, without anticoagulant. So, ganyan karami yung usually kinukuha natin sa patient. So, temperature should be less than 37.5. So, again, walang lagnat. Pulse rate should be around 60 to 100. Less than 50 kapag athlete yung donor. So, pwede din yun. And then, ang BP. Okay, sa BP, ang ating basically normal, tinatanggap natin around 120 over 80 ang BP. Okay? But, depende pa rin sa medical evaluation ng doctor na nandun sa blood service facility. So, basically, ang range ng systole is 90 to 160. Then, diastole is 60 to 100. That is the Philippine range. Sa WHO naman, that is, ang systole is 100 to 140, and then ang diastole is 60 to 90 mHg. Yun. And then, you have less than 180. Basta less than 180 ang systole, and then less than 100 ang diastole, ay pasok pa. Okay? Pero usually, ang on Philippine setting, around 100, 120 over 80 ang kinatanggap natin. Okay, pero again, based sa medical evaluation pa rin. Hemoglobin and hematocrit, okay, sa male, ang minimum is 135 grams per DL, maximum 185. For the female, minimum 125 grams per DL, maximum 175 grams per DL. For the hematocrit naman, greater than 38% dapat. Okay. So, fluid and food intake. So, usual food and fluid intake lang. Okay. So, avoid heavy or fatty meals lang. And then, at least 500 ml of drinking water is recommended before donation. So, hindi dapat dehydrated si patient. So, hazardous occupations and leisure activities. So, not advised to undertake strenuous physical activities for up to 24 hours after donation. Okay, so after donation, advice kay patient is pahinga muna. Okay, some occupations carry increased risk of exposure to blood-borne infections. Example of that is those yung mga sex workers, sorry. So they are at great risk for TTI, so they are usually deferred. Okay? Yeah. Gender. So, pag female, yung mga postpartum and breastfeeding moms, so 1 year after delivery, pa sila pwedeng donate. Kapag may mens, kapag excessive ang bleeding, malakas ang dalaw, deferred muna. Okay? So, interval of donation. So, for whole blood, you have for Philippines, every 12 weeks or every 3 months. Okay? Pero according to WHO, pwede na yung 56 WHO and AABB. 56 days or every 8 weeks ang whole blood donation. So, rare blood types, so males can donate for up to 6 whole blood donations per year. Ang female na up to 4 whole blood donations per year. Sa mga rare, ang blood type. Ay, sorry. Pag hematopoiesis, every 2 days pwede. Double RBC, every 16 weeks. Plasma kapag frequent, every 48 hours but no more than 2 times in 7 days. So, pag plasma infrequent, every 4 weeks. You have single apheresis platelet every 2 days. Granulocytes every 2 days interval. Okay. Meron na rin kayong na-discuss na rin to sa lecture, di ba? So, deferrals, again, what are the different types of deferrals? You have your temporary, definite, and permanent deferral. Temporary deferral is prospective donor is unable to donate for a limited period of time lang. Indefinite naman is unable to donate si donor for an unspecified period of time due to regulatory requirements. And then permanent deferral naman is they will never be eligible to donate blood for someone else. So, what are the different conditions ng permanent deferral? So, you have your chronic alcoholism, anemia, angioplasty, severe asthma, autoimmune diseases, cancer, Chagas disease, convulsions, CJD, Hepa B, STI, okay, so, and so on and so forth. So, hindi ko na babasahin isa-isa. Ayan, kabisaduhin nyo na lang yan. So, you have your permanent deferrals. Ito naman yung temporary deferrals. So, 1 year after a major organ surgery, deferred si patient. 1 year after ng body piercing, tattoo, you have your dental surgery, needle stick injury, Hepa B, immunoglobulin, and naka-receive ng transfusion. 1 month, you have your dengue, without transfusion. Pero pag nagkaroon ng transfusion, so that makes it 1 year na. So others, for abortion, that is 6 weeks. Alcohol intake is 12 to 24 hours. Dental extraction is 72 hours. Hepa A, 6 months after. Liver tests, liver function tests are normal. Okay, so ano pa ba? Common cold, 1 week. Allergy, as long as fit and well during donation, pwede mag-donate. So, okay. Okay. And then malaria. Malaria is deferred 3 years after treatment. So, deferred siya. Kapag travel lang to endemic area, so 6 months from the date of departure. Pag travel to endemic area, with or without prophylaxis, 6 months din. And then kapag former resident ka for more than 6 months sa endemic area na may malaria, so 12 months naman ang iyong deferral. Okay, so what are the different medications? Ito, may copy na rin kayo nito for your lecture. So basahin nyo na lang ulit. Different vaccines. So we have your 1 year, 2 months, 1 month, and 1 to 2 weeks ni na referral. So, in addition to this, i-add ko yung for our COVID vaccine. Okay, so for the COVID vaccine, so according kay Red Cross, as per Red Cross, as long as wala kang symptoms, you can donate. Okay? Okay, but that is for sorry. For vaccines that do not contain live virus. Okay? Yun. But if symptoms appeared after the vaccination, deferred ka for 28 days. Okay? So again, for not live vaccines. According kay WHO, pag live virus vaccine ang ginamit, or live virus vaccine type, yung COVID vaccine na ginamit kay donor, defer muna for 4 weeks. Okay, 4 weeks. Yun. Okay. So apheresis donation. So apheresis, this is a mechanism for collecting specific blood component while returning the remaining whole blood components back to the patient. Okay, so centrifugal force separates blood into components based on density. So we have different apheresis. You have platelet, pwedeng plasma, leukocytes, or red cells lang. For platelet, that is, ang platelet count is around 200 times 10 raised to 9 per liter. So, ang interval niya is every 2 days. For plasma, that is a total protein, at least 60 grams per liter. Okay. Ang weight for persons, that is 50 to 80 kilograms. So, less than 500 ml na whole blood or the plasma, I believe to, nakukunin. And then for greater than 80 kilogram, sorry, 80 kilogram na person, less than 600 ml. Okay, so this could be taken every 48 hours for those frequent donors, pero pag infrequent, that is 4 weeks. Leukocytes, you have your special agents, you have your hydroxyethyl starch, you have your corticosteroids and growth factors na ginagamit natin for leukophoresis. And then for red cells, that is every 16 weeks. Okay. So directed donation. What is directed donation? So this blood is donated and directed for the use of a family member, friend, or specific individual in need. So donors must meet all the criteria for allogenic blood donations. Okay. So it is ideal if donor is blood relative, unit must be irradiated. So this one is directed donation. So the name itself, magdodonate ka, alam mo na kung kanino siya mapupunta. Ganon. Okay? So pag relative yung blood relative yung donor and yung patient, ayun. So, unit must be irradiated. So, we also have what we call therapeutic phlebotomy. Okay? So, therapeutic phlebotomy, these are the cases na yung unit of blood is collected as treatment for blood disorders. So, sadyang kinukuhanan or sadyang kailangang mag-donate ni patient, mag-donate the patient para ma-relieve yung kanilang blood disorders. So, what are the example of this? You have your polycythemia vera, your hemochromatosis, porphyria cutanea tarda, and sickle cell disease. Okay. So, polycythemia vera is a progressive myeloproliferative disorder associated with significant erythrocytosis causing high viscosity. So, WBC and platelets are also increased. Okay. So, polycythemia vera, masyado siyang maraming erythrocytes. So, masyadong malapot si dugo. Okay? So, pag nag-donate siya ng blood, of course, mababawasan yung blood niya, makakatulong sa kanyang sa viscosity ng blood. So, mababawasan, medyo lalabnaw. Okay? So, it will reduce the risk of thrombotic events. Okay? So, hemochromatosis. Hemochromatosis naman is an excess iron deposition in different organs and tissues. Okay, so frequent blood donation naman should be based on serum ferritin levels and transferrin saturation. Okay, so for hemochromatosis, excessive iron naman siya. Okay? So, pag binawasan sa blood, mababawasan yung hemoglobin which also contains iron component, 'di ba? So mababawasan yung iron deposition. So dun nakakatulong siya sa hemochromatosis. Okay, so you have PCT, porphyria cutanea tarda, PCT. This is a uroporphyrinogen accumulation in the liver, plasma and urine because of the absence of enzyme uroporphyrinogen, decarboxylase. Okay? So this one is a chronic blistering skin manifestation with photosensitivity. Lastly, we have sickle cell disease. So blood viscosity is decreased due to the reduction of hemoglobin concentration. So this causes reduced HBC polymerization. Okay. So that's it for for this week's discussion. So thank you for listening. If you have any questions, feel free to message for your respective instructors. Okay? So thank you and God bless.